Reduce salt, reduce salt. This is one of the most provided advice whenever somebody has been diagnosed with high blood pressure. But what if I told you that the sugar you consume every day is the biggest culprit? It could be silently raising your blood pressure without you even realizing it. Not salt, not stress, but sugar. And today, I will show you exactly how this happens. Welcome to Metabolic Talks. I am Dr. Kabongo. In this video, I will break down step by step how regular sugar consumption can lead to hypertension. How does something as simple and common as sugar, something that you consume on a daily basis, the major source of our energy, end up damaging your blood vessels, causing dramatic events like stroke and heart attack? To start with, let me bring you back to my medical training era. About 30 years ago, when I was still in medical school, high blood pressure was classified, and still is, in certain manuals, as 90 to 95% being essential, meaning that the cause is not really known. The remaining 5 to 10% was classified as being secondary high blood pressure, meaning that the cause is known. Common known causes of secondary hypertension include kidney diseases such as chronic kidney disease or renal artery narrowing, hormonal disorders like Cushing syndrome, as well as tumors of the adrenal gland. Other contributors include thyroid dysfunction, obstructive sleep apnea, and certain congenital conditions like coarctation of the aorta. In addition, certain medications, yes, you have heard it well, medications that you take to treat other conditions can be the cause of your elevated blood pressure. Prescribed drugs such as oral contraceptives, non-steroidal anti-inflammatory drugs like Alive, ibuprofen, and corticosteroids are among the common culprits in my 2 decades of practicing family medicine. More and more evidences have emerged pointing at sugar as being the biggest contributor to what was previously known as essential blood pressure. It is not just a simple coincidence. Researchers found that up to 70% of people with type 2 diabetes also have hypertension. Sugar doesn't just affect your glucose, it silently drives your blood pressure up. Diabetes increases the risk of developing hypertension by about 1.3 to 1.6 times. The coexistence is so common that they're often called cardiometabolic twins. When we talk about sugar, we have to understand that it presents itself in different forms and shapes. In our nutrition, sugar is consumed in many forms throughout the modern diet, often without people realizing it. It can be ingested as natural sugars found in fruits and milk, but the main concern comes from added sugars in processed foods. These include table sugar, sucrose, sweetened beverages like sodas and fruit juices, baked goods, candies, breakfast cereals, and flavored yogurts. A major hidden source is high fructose corn syrup, commonly used in soft drinks, sauces, and packaged snacks. Sugar is also present in seemingly healthy products such as granola bars, smoothies, and low-fat foods, where it is added to improve taste, making overall intake much higher than most people realize. Let's follow the journey from your plate to your arteries. Here is the chronological progression from regular sugar consumption to the development of hypertension. If you stick until the end of this presentation, you're going to understand as well the association of gout with high blood pressure, diabetes, kidney stones, and chronic kidney disease. Without further delay, let's dive into the subject. For better understanding, we will chronologically review the effects of sugar on your blood pressure in 3 steps: in short-term, medium-term, and finally long-term exposure effects. 1. Short-term acute effects, days to weeks. Fructose ingestion. It all starts with fructose. Fructose is often called fruit sugar because it is found in fruits, honey, and some vegetables. It is one of the 3 main dietary monosaccharides, along with glucose and galactose. It is naturally found in fruits, apples, pears, mangoes, honey, in processed foods as high fructose corn syrup HFCS, in table sugar also called sucrose, which is 50% fructose plus 50% glucose. How the body handles sucrose. In the intestine, sucrose is broken down into glucose and fructose. Glucose enters the bloodstream and raises blood sugar, whereas fructose is processed mainly in the liver and is processed rapidly, consuming cellular ATP energy in the process. The breakdown of fructose produces acute uric acid elevation, increases serum uric acid levels, and consequently reduces nitric oxide. What are the consequences of nitric oxide reduction? Nitric oxide, NO, is essential for blood vessel relaxation and normal blood flow. Medications like sildenafil, Viagra, commonly used in the management of erectile dysfunction, work by enhancing the effects of nitric oxide. In fact, at its origins, sildenafil was not a sex medication. It was originally used in the late 1980s as a potential treatment for angina to improve blood flow to the heart. Although it showed limited benefit for chest pain, researchers observed an unexpected side effect: enhanced erectile function. Recognizing its clinical potential, Pfizer redirected development, leading to its isolation, clinical validation, and eventual commercialization in 1998 as a groundbreaking treatment for erectile dysfunction. This mechanism highlights the critical role of nitric oxide in vascular health and its importance in conditions like hypertension. Within weeks, these changes can trigger inflammation and reduce the flexibility of blood vessels, causing the blood pressure to rise up. Elevation of the blood pressure is usually silent, but the lack of vessels relaxation causing erectile dysfunction is sometimes the only sign that pushes patients to consult. Allow me to tell you about Kuldeep, 41 years old patient of mine, who consulted for struggle to get intimate with his 35 years old wife. Our initial consultation was virtual, and I called him to come in. In 2 years, I hadn't seen him. Kuldeep had clearly picked abdominal weight with a waist circumference of 114 centimeters. For a BMI of 34, his measured blood pressure in the office was 160/100 millimeters of mercury. Assessing his diet, he confided to me that he had been eating junk food and drinking soda since he started his new job 2 years ago as a truck driver. In the course of this video, I'm going to tell you how this patient tremendously overturned his life just by simply modifying his eating habits. If so far you find this video informative, please subscribe and activate the notification bell so you don't miss similar video in the future. After the acute phase, then come intermediate changes. 2. Intermediate metabolic changes, weeks to months. High regular intake of sugar forces the pancreas to overproduce insulin, leading to insulin resistance, meaning your cells stop responding to insulin, pushing the pancreas to produce even more insulin, leading to hyperinsulinemia. Persistently high insulin levels cause the kidneys to retain more sodium and water, increasing blood volume and placing pressure on vessel walls. There is also sympathetic nervous system, SNS activation. High sugar intake, particularly fructose, increases SNS activity, triggering a chronic fight or flight response, which causes blood vessels to narrow, what we term vasoconstriction. Chronic inflammation and oxidative stress damage the vessel lining, also called endothelium, limiting the ability of vessels to widen. You would remember that this Teflon-like coating, which is protecting the inner lining of your vessels and produces nitric oxide, the chemical that keeps your vessels dilated, is very crucial in maintaining good functioning of your vessels. The result is endothelial dysfunction with poor nitric oxide production and low-grade inflammation. 3. Long-term development of hypertension, months to years. A. Weight gain and visceral fat. The excess calories and insulin resistance lead to weight gain, particularly around the belly. Visceral fat releases inflammatory factors that worsen blood pressure. Visceral fats. Not the layer of fat under your skin, but the fat contained between your internal organs. The one that makes your waistline to increase is not just storage, it acts like an endocrine organ, releasing inflammatory chemicals and hormones such as pro-inflammatory cytokines and free fatty acids that further damage vessels' inner lining. Angiotensin II, powerful vasoconstrictor. Aldosterone, causing water and salt retention. Leptin increases heart rate and vascular tone. The result is tightened blood vessels, retaining of salt and water, and ultimately elevation of blood pressure. B. Structural remodeling of blood vessels. Chronic vasoconstriction leads to structural changes where blood vessels become permanently stiffer and narrower, increasing peripheral vascular resistance. C. Renin-angiotensin-aldosterone system, RAAS. Overactivation. Increased uric acid and metabolic stress activate the RAAS, leading to further vasoconstriction and fluid retention. The renin-angiotensin-aldosterone system, RAAS, is one of your body's main ways of controlling blood pressure, blood volume, and fluid balance. Think of it as a smart emergency system that kicks in when your body senses that pressure or fluid levels are too low. Uric acid, especially from high fructose intake, can activate RAAS by impairing kidney blood flow, reducing nitric oxide, and stimulating renin release. Hypertension, chronic high blood pressure. The combination of increased fluid volume, constant vasoconstriction, and stiffened vessels results in sustained, clinically diagnosed hypertension. Practical advice: reduce added sugar in your diet. Avoid sugary drinks and processed foods. Choose whole natural foods instead. Drink more water throughout the day rather than sweetened beverages. Stay physically active and monitor your blood pressure regularly. Small changes, repeated daily, can reverse this entire process. This is exactly what Kuldip applied. In 4 months, he lost 18 pounds. His waistline dropped from 114 centimeters to 103 centimeters. His blood pressure went down to 140/85 mm of mercury, while his measured blood sugar came down from hemoglobin A1c of 6.4 to 5.8. In addition, he confided that his marital life improved, what increased his confidence and took away his performance anxieties. Big insight. High blood pressure is not just about salt. It is often the result of years of metabolic stress. Sugar doesn't act alone, but it plays a major role in silently damaging your system. The same habits that created the problem can also become the solution. Conclusion: your health is shaped by what you do every day. What, how, when, how much you eat, drink, move, manage your stress, handle your sleep and your environment. If this video helped you understand your body better, share it with someone you care about, because this knowledge can prevent serious disease. And don't forget to subscribe for more content on health, prevention, and living better.